I think when EMS providers evaluate older adults, one thing that's important to keep in mind is that um, changes in mental status should be considered an acute and potentially reversible event until proven otherwise. So that taking a systematic approach in evaluating older adults with mental status changes is critically important. Systematically looking for things like altered blood sugar levels, altered oxygen levels that may create acute medical emergencies for older adults and younger adults. I think the next important piece is to look for focal neurologic findings because this can change your approach to that patient, leading you down more of a neurologic workup and evaluation. And then finally, being attuned to what the level of consciousness is, because how attentive an individual it is can also give you clues to whether they may have things like delirium.
Some common causes of altered mental status in older adults are dementia, urinary tract infection, blood sugar, stroke. It can be a whole gambit of things, and oftentimes it's something really bland like a urinary tract infection that causes it, but we need to rule out the most severe things first.
So distinguishing delirium and dementia is a very common medical issue. One of the key things is remembering how delirium is defined. So delirium is defined as something with acute onset. This is something that should be different than dementia. Dementia, by definition, should be a slowly progressive or a chronic illness. Delirium should occur in more of an acute fashion. It should be accompanied by what they describe as a waxing and waning level of consciousness. So people may be very sleepy, and that may oscillate to a period of being very agitated or almost hyperstimulated. You can see both types of patterns in delirium. And then there should be some confusion associated with delirium. This is common also in dementia. One of the main challenges is that dementia is one of the main risk factors for delirium. So often you'll see both at the same time. People who have a diagnosis of dementia who, for whatever acute illness or acute reason, also have delirium. Well, I think one of the main misconceptions about older adults is that confusion or altered mental status states are normal, when in fact people as they age really shouldn't have confusion or changes in their mental status. Dementia is a very common diagnosis and increases as people age. So among those around the age of 65, dementia is seen in about 2% of people. As you move up in years, 75-year-olds about anywhere from 5 to 6% of individuals will have dementia. 85-year-olds, it increases further to about 20% of 85-year-olds. And when you look at the fastest segment of the population in terms of growth, those over the age of 90, about a third of individuals will have dementia or dementing illnesses. So it's actually the exception, not the rule. Most people, as they age in a healthy fashion, should maintain their ability to think clearly and maintain a normal level of consciousness. Right, so determining the patient's baseline mental status is really very important and critical to good healthcare and medical evaluation. This is really one of the pieces to the puzzle that can unlock a lot of the diagnosis, because it allows you to tell how a person is changed from their usual state. I think in common practice, the best way to find out a person's baseline is to talk to those around them. So bystanders, neighbors, family members. This is a place where often emergency medical providers have a lot of advantages because they're in a home or a usual environment for the patient, so that they can talk to people who know them on a day-to-day basis and give a sense of what their usual function is like, what their usual thought processes are like. And that little bit of information can really help guide how a person's changed in the setting of illness, and help medical providers unlock some of the clues in diagnostic evaluation.
There's many obstacles in evaluating the mental status of older adults. Some of them, like a language barrier, could happen with anybody, but can become exacerbated with an older adult. And so if you have an interpreter, or at least know that they have a language barrier, that might be beneficial. Other ones might be if the patient's hard of hearing. A lot of these patients are hard of hearing, and sometimes they have their hearing aids in, sometimes they don't. Maybe consider that. Also, if they're hard of hearing, you can consider using a pen and a piece of paper. And just a simple thing is being at their level and talking to them loudly and in a way that they can see your face so they can read your lips. Something else is a lot of older people lose their higher end frequency hearing first. So try not to talk in a real high-pitched squeaky voice, because they might hear you better the lower your voice is. The other two things I'm thinking of in terms of obstacles for evaluating the mental status of an older adult are dementia, because it's very difficult to determine what's their baseline status. Is this caused by their baseline dementia, or is it something that's of a new onset? And the other thing that has to do with previous history is traumatic brain injury or stroke that's caused aphasia and other things that are making the assessment of their mental status difficult. Well, I think obviously you want to try and determine the person's orientation to person, place, and time, but oftentimes that's fairly difficult for an elderly person in a nursing home because they're pretty detached from the real world a lot of times. So I try to ask them questions that might be a little more relevant to their lives, such as things about what their last meal was, or some of the activities that they do at the nursing home, or some of the things throughout that are in their room. You can use clues from them to see what they might know the answer to, because maybe they don't know what day it is or what the date is, not because they have an altered mental status, but because it's just not relevant to their lives. Some other resources that can be used when assessing a patient with altered mental status include the obvious ones, such as consulting their chart, or talking to their caregivers, such as their nurses, or even talking to some people who you might not normally think about talking to, like the dining staff or the cleaning staff or other patients, because they don't all have altered mental status all the time. But I think some more esoteric things to think about are maybe looking around to see, do they have crossword puzzles on their table, or do they have a coloring book? Or do they have Sudoku games, or a blankie and a teddy bear? And those things might be significant in determining what their baseline mental status is. So using context clues and things that are around their room is important.